While performing an open herniaplasty, the surgeon discusses the anatomical triangle at the operative site with the second year MBBS student. Which of the following is not a boundary of the Hasselbach's triangle? So the question here is direct, right? They're asking which does not form the boundary of the Hasselbach's triangle. This diagram holds some key anatomical landmarks. This is medial side, this is lateral, and here we can see rectus abdominis muscle, inguinal ligament, and this is external iliac artery. Arising from the external iliac artery is our inferior epigastric artery. So there is our triangle. This is Hasselbach's triangle. So what is the boundary? Medially, it is formed by the lateral border of rectus abdominis. Inferiorly, it is formed by inguinal ligament. Laterally, it is formed by inferior epigastric artery. So we already got our answer, right? But let me talk about fascia transversalis and Hasselbach's triangle in detail. So consider this as a representation of the anterior abdominal wall. This is anterior, this is posterior. Skin, deep to skin, we have subcutaneous tissue. Deep to subcutaneous tissue, we have external oblique muscle, followed by internal oblique, followed by transverse abdominis, followed by transversalis fascia, followed by peritoneum. Once you reach beyond this point, we enter into abdominal cavity. As I told you earlier, we have skin followed by subcutaneous tissue, followed by we have external oblique. So in this image, we can see this old brown muscle is our external oblique, and this external oblique continues as external oblique aponeurosis. The small triangular opening in the external oblique aponeurosis is superficial inguinal ring. Deep to external oblique, we have internal oblique. So this old brown muscle is our internal oblique. Deep to internal oblique, we have transverse abdominis. So this is our transverse abdominis. So far, we have not seen transversalis fascia. So when you go deep to transverse abdominis, you can see transversalis fascia. This whole white layer is a transversalis fascia. If you observe carefully, there is a hole opening in the transversalis fascia, and that is our deep inguinal ring. So in this image, we can clearly see this is our rectus abdominis muscle, and this is our inguinal ligament. This is our external iliac artery, and arising from the external iliac artery is our inferior epigastric artery. This is our inferior epigastric artery, inguinal ligament, and rectus abdominis muscle. So this is our Hasselbach's triangle. So this white layer is our fascia transversalis. So when this fascia transversalis is weak, through this area, content will pop out. So this is the significance of fascia transversalis and Hasselbach's triangle. In this video, we can observe fascia transversalis, the white layer, external iliac artery, and from external iliac artery, we have inferior epigastric artery running upside and rectus abdominis muscle. So there is our Hasselbach's triangle.